If you are currently working and thinking about collecting Social Security benefits, you need to learn about the rules for 2025. Otherwise, you risk having your Social Security benefits cut. I am also going to talk about the income limit and what happens if you go over it. And also, I'm going to talk about what the Social Security Administration considers as income when they are looking at your income limit. Is it joint income with your spouse, or is it single income? I'm also going to talk about what happens if you go over the limit and they withhold money from your Social Security check. What happens to that money? And then finally, we're also going to talk about spousal consideration. What if you start collecting Social Security, but your spouse decide not to, and they're waiting till later? How does that affect all of that? I am going to discuss that in detail. And then stay to the end of this video, because I am going to talk about Medicare. If you're collecting Social Security, Medicare is a big part of that. If you're currently receiving Medicare, I'm going to talk about how you can save $1,100 a year. Hello, I'm Kwame Kwade. I am an entrepreneur and personal finance expert. For 15 years, I've been helping seniors get the retirement benefits they deserve. We started with websites on Social Security, Medicare, Medicaid, food stamps, and now we are adding video content. I am also an adjunct professor. I teach finance at one of the most prestigious universities in the United States. If you're new here, hit the like button, hit the subscribe button. I really, really appreciate your help and support. And finally, as always, I want to know where you're watching this broadcast from. Do me a favor, go into the comment section and let me know your city and your state. But let's dive in. Let's talk about working while collecting Social Security and what the rules are for 2025 and what you must know in order to make sure that you're maximizing your benefits. So, the earnings limit for 2025 is $23,400 for those under full retirement age. Social Security will deduct $1 in benefits for every $2 that you go above that limit if you haven't reached your full retirement age and are collecting Social Security. So if you're making the decision to start collecting Social Security and you are under your full retirement age, which for some people is 66 years and 10 months, or starting next year is going to be 67 for some people, then you are going to be under this rule. You can still work, but you have to watch the earnings limit because your benefits will be reduced. In the calendar year you reach your full retirement age, the limit then increases. It's more generous to $62,160. For earnings above this amount, Social Security will deduct $1 for every $3. So when you reach your full retirement age year, the earnings limit is more generous. Once you reach full retirement, then there are no limits. You can work and collect Social Security and they would not deduct anything from your income. But then you may then fall into a higher category of income and you may be subject to Social Security taxes on your Social Security benefits, your combined income. Only income. So what income counts? What is Social Security going to look at when they are trying to determine whether you've breached the earnings limit or not? Well, only wages, self-employment income, bonuses, and commission are counted towards your income limit. Pensions, investment income, interest, annuities, and other government benefits do not count towards that income limit. Now, how about the benefits being reduced and what happens to that? Well, if you expect to exceed the earnings limit, Social Security will withhold monthly payments at the beginning of the year. They calculate the total withholding needed and then suspend your monthly payments until that amount is covered. So essentially, if they decide that you are going to go over the limit by, let's say, $5,000 and you're receiving $1,000 a month, then they're going to suspend your benefits and then until the 5,000 is covered, and then they're going to resume sending you a Social Security check. You should report your expected earnings to Social Security Administration to avoid overpayments. Now, there's a lot of news around overpayment now. It used to be that if you owe Social Security money due to overpayment, they only take 10% of your Social Security check until the money is paid back. Now they are doing 100%. The Trump administration has changed the rule to 100% or gone back to what it was before. And so overpayment is not a good thing. So it is important to report your earnings to Social Security so that the accurate amount will be calculated and deducted from your benefits. In the first year you receive benefits, Social Security may apply a monthly earnings test if you retire mid-year. This special rule allows you to receive full benefits for any month your earnings are below 1,950, regardless of your total earnings. So this is a special rule that happens in the first year that you start collecting benefits while working. After the tax year ends, Social Security will receive information from the IRS about your actual earnings and make necessary adjustment. If too much was withheld based on your estimate, you will receive the difference back. If too little was withheld, you will need to repay the excess back to Social Security. So who is affected by the earnings rule? Well, early retirees. The earnings applies to anyone who collects Social Security retirement benefits before reaching their full retirement age. Full retirement age ranges from 66 to 67, as I mentioned. And for people born after 1960, it's going to be set at 67 starting next year. Those on spousal and survival benefits also have to meet the earnings test. The earnings test also applies to spousal and survival benefits if you are receiving these benefits before your full retirement age. Your work income can reduce these payments according to the same limits and formula. If you're a working spouse, this is also something you need to think about. If you're married and your spouse works while you collect benefits, their earnings do not affect your payments. The earnings test only applies individually to each person receiving benefits, not to the household income. And then there's disability benefits that are under different rules. Different rules apply if you receive Social Security Disability Insurance, which is SSDI. In 2025, you can earn up to $1,620 a month and $2,700 if you're blind without affecting disability benefits, as those have separate what they call substantial gainful activity standards. It's very important if you're on disability benefits to not breach the substantial gainful activity limit, because that could have consequences for your benefits, because it will cause the benefits to be reduced or in some cases terminated altogether, because it shows that you are able to work if you're earning that much money according to the substantial gainful activity limit. All right, moving on. Let's talk about the letter you are going to get about all of this. So when you reach your full retirement age, Social Security will recalculate your benefit amount to give you credit for months when benefits were reduced or withheld due to your earnings limit. This means most of or all the money that was withheld due to the earnings test will be returned to you over time. This is very important. A lot of people think that the earnings test is a permanent loss, so that if they deduct money from your Social Security benefits because you breached the earnings test, that money never comes back to you. That is not true. Once you reach your full retirement age, they will recalculate your benefits and credit you back money that they've taken. The recalculation essentially treats you as if you had claimed benefits later than you actually did. If you lost 12 months of benefits to the earnings test, your benefits will be recalculated as if you claimed benefits 12 months later than you did. So essentially what it means is that if you are working, you are paying into Social Security. And so you are increasing your potential future benefits. So when you reach full retirement age, that is when your benefits are going to be permanently set. Then they recalculate it and then credit you back as if you had worked into the system and are not collecting benefits for the period that they took the money. I hope it makes sense. Continuing to work may increase your benefit amount if your recent earnings are higher than the previous earnings. Social Security calculates your benefits based on your 35 highest years. So replacing lower earnings years with higher ones can boost your benefits. That is really important, because remember, they take 35 years, the top 35 years of your working years, and then that's what they use to calculate your primary income amount, which is the baseline for your Social Security benefits. Each year, Social Security automatically reviews the records of all beneficiaries who had wages in the previous year. If your latest year of earnings or your last year of earnings is one of your highest, then they replace it with one of the lowest ones in your 35 that they already have. And so then they will recalculate your benefits again and pay you any increase retroactively to January the following year. So here are some things to think about. while you make this decision to take Social Security while working. If you plan to work while receiving Social Security benefits before your full retirement age, estimate your earnings carefully. Consider whether it makes financial sense to claim benefits if your earnings will cause significant benefit reduction. So that's something you need to talk to your tax professional or your financial advisor about. In addition, there are also tax consequences. Working while receiving Social Security will bump you into a higher tax category and may make subject up to 85% of your Social Security benefits to taxation. Now, when you're working past age 65, there's also Medicare you have to think about. I have some great news about Medicare. So if you are working under your full retirement age and you haven't signed up for Medicare yet because you're not yet 65, wait till I talk about Medicare because I have some very good news that you need to hear about. But if you have health insurance from your employer with 20 or more employees, you may be able to delay Medicare enrollment without penalty. Now, there's some special consideration. Self-employed individuals have the same earnings limit. However, only net profit counts towards the limit. So if you own a business, certain strategies are there that you can employ regarding timing of income and business expenses that may help manage how this affects you. Contact a professional for more details on how to do that. Now, here are some important reminders for 2025 that you need to know about if you're going to be working and claiming Social Security. Your full retirement age depends on your birth year. It ranges from age 66 to 67. Knowing your exact full retirement age is crucial for understanding when your earnings limit is no longer applicable. And then there is monthly versus annual test. For most beneficiaries, the earnings test is annual, but in your first year of claiming benefits, you may use the monthly test. The monthly test allows you to receive full benefits if it's less than $100,950, regardless of how much you earn. Now, it's important to keep documentation of all of this, especially your earnings records. So keep your records of your work earnings and any communication with the Social Security Administration, especially now that there's so much turmoil and there's so much changes that are happening. You may want to keep records when you talk to Social Security, who you talk to, what you discussed, and what they told you, etc. Good communication will help resolve any discrepancies or questions about benefit adjustments. And then, what about delaying benefits? That's something you need to talk to your financial advisor about. If you are still working and earning substantial earnings, consider whether delaying your Social Security claim until you've reduced your work hours or reach full retirement age might be more advantageous financially to you. Each year you delay benefits after full retirement age, it increases your Social Security benefit by 8% up until age 70. So here are 5 things you need to know. Your earnings limit is $23,400 for those who are retiring under full retirement age and working. And then in the year of your full retirement age is $62,160. And then once you pass full retirement, you can work as much as you want and nothing will be deducted. And only work income, wages, self-employment income counts towards the earnings limit. Your pension, investments, and other non-work income do not count. And then how much are they going to take out? Social Security withholds $1 for every $2 you go above the limit if you are below your full retirement age. And in the year of your full retirement, they will take $1 for every $3 you go above the limit. And then after you reach full retirement, you can work as much as you want and doesn't affect your benefit. And then money withheld due to excess earnings isn't lost forever. Your benefit amount will be recalculated and increased when you reach full retirement age. So I promised to talk about Medicare, so let's talk about it. Now, before I do that, if you have any questions about working while collecting Social Security, whether you're currently doing it or you're thinking about working and collecting Social Security, let me know in the comments section below. So Medicare, well, here's the thing. If you are currently turning 65, you know you have to sign up for Medicare 3 months before your 65th birthday, and then 3 months after. You have a 7-month window to do that. Why is that important? Because there are penalties if you don't. And with all the changes that are happening in Medicare today, it's important that you know what the rules are and what things you need to consider to pick the Medicare plan that fits you and your needs. Now, in certain states, plans are being dropped, and in certain states, people have to make a decision whether they want to stick with their doctor or stick with their health plan. And so you may be thinking, okay, why is this all relevant? Well, it's relevant because 90% of all seniors are in the wrong Medicare plan because it is so complicated to figure out the right plan for you, your budget, the kind of coverage you need, and there are restrictions by each plan. They have options, they have costs that you need to consider. Factoring all these, and then for some of the plans, they are location specific. It means that certain plans only are available in your state and in your local area. So you have to put all that together, and that's why it gets so frustrating. So we have a solution. We have partnered with an organization we think is going to be able to help you. Their service is free to you, and here's why this is important. Their whole mission is to make Medicare simple so that you can understand it, and then once you understand it, you can choose the best plan, and then they can help you then use your benefits fully because you've earned Medicare. So it's important that if you're getting it, you're also taking advantage of everything it has to offer. So Chapter Medicare is the organization, and one of the things that attracted us to them and why we're partnering with them is that, this business partly got started out of a personal experience. One of the co-founders watched his parents struggle to navigate the process of choosing a Medicare plan and wind up paying premiums that were hundreds of dollars a month, which is a lot of money, especially if you're on fixed income, more than they ought to have been. He realized what a terrible experience this was and decided to do something about it. And then another one of their co-founders actually wrote a book, one of the leading books on Medicare. It's called It's Not That Complicated. So their whole mission is because they figured out that a lot of people get into the wrong Medicare plans because nobody sat them down to really explain to them what is going on, what are your options. And so Chapter Medicare is that organization. Their services are free to you. They offer unbiased opinions, and they do not incentivize their agents to push specific plans. They are there to advocate for you and not the insurance company. And I know that can come as a surprise in today's world, but yes, that's their whole mission, is to help you figure out what plan is best for you. And they have access to all the plans. They're the only company that has access to all the 24,000 Medicare plans that are out there. So they know what is in your area and can help you pick a plan. And these are the agents you're going to be talking to. If you go to their website, these are the real humans that when you call them, you are going to be talking to. And their goal is to show you every Medicare option available to you, including detailed information about which doctors, specialists, prescription drugs, and hospitals are covered, what copays and costs that you can have to deal with, and then they'll help you compare all of that to traditional Medicare. So call them today, 539-205-2147, or go to askchapter.org/insider. These guys are the real deal. They can help you make the best decision on Medicare, and they are highly rated by the Better Business Bureau, and they can save you $1,100 a year. So call them at the number on the screen, or go to the website, or you can even go to the description to this video, and there is a link there. You can fill out the form, and they'll reach out to you. But you may have a very short window to act, especially if you want to switch to a better Medicare plan, or if you are trying to get on Medicare at age 65, your window is short. So call them today, 539-205-2147, and they will be able to help you. They're highly rated by the Better Business Bureau, A+, and tons of 5-star reviews that you can look up for yourself online and make a decision. But these guys are the real deal, so call them. And then finally, if you've been keeping up with our content, you realize that there's so much happening around Social Security, Medicare, Medicaid, food stamps, personal finance issues in and out of Congress that can affect your retirement and your benefits. And so we have a newsletter that you can sign up for. Go to the description to our YouTube video. There is a link there. You can click and sign up directly. Why is that important? Well, we will help you stay on top of what is happening and everything in and out of Congress that could affect your benefits. We want to bring it to you. And then we have money saving tips that we can share with you that does not make it on every video, but at least will be on the newsletter. So sign up today. And that is pretty much all I have. So until I see you tomorrow on the next video. Thank you for watching.